Welcome back to my channel, people. Today I want to talk about, if I'm not looking at the videos because I'm walking and I don't want to fall, but today I want to talk about what really goes on in nursing. And to all my nurses out there, drop a comment down below if you agree. First of all, I want to start out by talking about, I don't know about every state, but in the state of Florida, nurse, I believe, is underpaid, right? Underpaid and overworked. And so with that strain alone, that you are overworked and underpaid, it makes life difficult. Next thing I want to talk about is these nursing homes and rehab, right? People who have their family members, they entrusted these management and the company to take good care of their family members, right? Reason being, a lot of people put their family members in nursing home is because they are not able to take care of them while continuing their life, while working or traveling or whatever the case may be. People who had surgery and come to the rehab, to get exercise and get better, gain back their strength and stuff like that to go home, they rely somewhat on reviews. And to be honest with you, it's like even going on these websites when we're buying clothes, people talk the truth, no? I could talk the truth. Going on these online things and reading reviews about the hair and on the bite is not what we thought. And some of the reviews say good things about the hair, good things about the clothes. But then when we get it, the quality of it is not what we expected. And so it is with people who choose rehab and nursing homes. No, the nurses in the nursing home and in the rehab, what these management do, because they want the CEOs and they want the bigger heads them to feel good about things, they give nurses more than what they actually can do in an 8-hour shift or a 12-hour shift. Let me give you an example. A nurse has 30 patients, because then every state has a different nurse to patient ratio, right? In the state of Florida, you can go up 30, 32 and more patient per nurse. So you as a nurse, let's put it at 30. You as a nurse have 30 patients, and they want you to do wound care, and they want you to chart, because documentation is very important in nursing, right? Especially when you're dealing with Medicaid and Medicare patients, you definitely have a chart, right? And so they expect you to finish giving medication, doing all treatment, wound care, chart, document on the patient, and then you have patients, you sometimes have trach patients, you sometimes have patients, peg tube patients, you have patients who, have different issues, right? And you have to be dealing with them patient who on wound vac, that takes a little bit more time and all these things, plus you're supervising CNAs. Now, be honest. How do they expect sometimes the nurses to complete their work? And some of them don't want you to do overtime, right? Some of them want you to finish on time, clock out, because all they're watching is the money. And so when you as a nurse talk out or speak to management and let them know, listen, patients are not receiving the proper care in which they will, in which they need, right? Then management consider you as, a threat to them, right? Not to mention when nurses just feel like, okay, this is too much for me, and they quit the job, then you're now working short staff, right? Management consider you to be a threat. Instead of taking what you're saying to them, right, and implement it and make things better, they consider you a threat and they want to get rid of you. No, I can talk from my story. I can't call company name. I can't disclose certain things. But managements are like that somewhat until later on down you only see corporate comes in and walk them out. Because what is happening, they're getting so much lawsuit, for negligence. They're getting so much lawsuit for so many different things. And so, when corporate come in, corporate are fired from the upper head, right? And then later on, you will find out, hey, that company went under. So that company no longer exists, right? I wish things would be better in the nursing industry, in the nursing field, because you have quality nurse out there, but they are being underpaid and being overworked. Again, I not make that video long. I just want to come out and talk about it because something have happened recently, and I was like, wow, only if that company had listened, you know, to my recommendation and to other nurses' recommendation when nurses are crying, hey, the workload is too much. You need to hire a wound care nurse to do wound care. You need to, you know, hire more people so that the workload is not so heavy. But no, they were not looking at that, right? All they're looking at, how can we fill these beds and how can we make more money? That's what they were looking at until now the company's gone under. It's sad to say that the company's going under, but at the same time, they need to listen to nurses. Because as nurses, we are the eyes and ears there. Management don't walk the floor. Doctors, sometimes when they come in, they just do a quick rounds. Some of them, if they even, you know, check out the patient, listen to the lung sounds and, you know, abdomen and all of these things, they go based on what we are saying to them. When in an emergency and a nurse call a doctor or whatever, if you're not working in the hospital and you're working in a nursing home, they're asking you what is going on. So we are the eyes and ears, but yet still we are underpaid and overworked. Shout out to all my nurses. Again, if you like what I'm saying, if what I'm saying have any truth to it, go ahead, give it a thumbs up. Comment down below, nurses. Even my CNAs, comment down below, because they too overwork and underpaid. You get what I'm saying? Because I was a CNA before I became a nurse, and it's not an easy job, right? Lifting patient, turning patient, changing patient, repositioning patient. It is not easy. It may seem easy, like, okay, you guys are doing nothing, but their job also is very hard, and you're also underpaid. So there you go, guys. That's it for today. I just wanted to come on here and to talk about the unfairness of nursing, you know, and how we nurses are being treated. I realized that if it wasn't for COVID let a lot of these companies see how valuable we are as nurses, because they treat us as we were nothing. And, oh, you need a job, or you need us, we don't need you. But COVID came around and COVID showed them, hey, nurses are valuable. And so they were willing to go above and beyond to pay nurses to come on board, because they realize our worth. Again, if you have not yet subscribed to this channel, go ahead, hit that subscription button. Turn on your notifications so each time I post a video, you will be able to see it. And I'm out. Peace.